they keep it. I'm going to go and get a smoke out.
Okay, see ya.
Must be winning.
Oh, thank you.
Okay, I think we'll make a start now. So, for those of you who haven't done this before, I'm going to record it. Excuse me, we've got a bit of feedback happening in the office as between our two computers. So we'll just sort that out. Okay, so what we're going to do is we're recording this for future reference. I'm going to mute everybody out so you won't be able to talk, but you'll be able to hear me. If you have any questions as you go along, you can type them in to the chat and they'll come up on our screens here, and then we can cover any questions you have at the end of the webinar, and you can then ask any more that come up from that, so we'll unmute you back then. Okay, well, welcome once again. So I'm going to mute you now. We're already recording, so we'll begin. Right. So this webinar today is on task 4 of the Stop Smoking Practitioners Program. It's tobacco control and health promotion. I thought I would start with the reason. Can you hear me, sir? Yeah. I thought, am I muted? Or not? I'm sorry, I'm just checking my thing. I'm just I've got my co-pilot here, Sue, so she's giving me instructions as we go to make sure this is as seamless as possible. So the Tobacco Control and Health Promotion Assessment Task 4, the reason we do that in the Stop Smoking Practitioners Program is twofold. So with tobacco control, it's really about practitioners understanding the statistics around smoking rates in New Zealand. You might know that the highest rate of smoking in the country is Maori women, and then Maori men, then Pacifica men, then Pacifica women, and it goes all the way down to general practitioners, doctors for instance, who only have about a 2% smoking rate amongst all GPs in the country, regardless of ethnicity. So there's a huge disparity in our populations. And so the Ministry of Health has prioritised those who smoke the most cigarettes daily, and our role then is to work with Maori, Pacific and pregnant women who smoke as our priority. So that's tobacco control. It's about learning who's smoking, where they're smoking, and you can get all that through statistics. So there's a bit of that in task 4. The health promotion, I worked for ASH New Zealand as a health promoter, and the reason that health promotion is included in the Stop Smoking Practitioners Program is those of you who work for a stop smoking service that is funded by the Ministry of Health, your service's contract with the ministry puts 5% of your service's budget into health promotion. So your managers will know this. So they have a 5% of their budget which they need to work around promoting health in their community or their region, wherever they're situated across New Zealand. So everybody really is a health promoter. Most of us do it quite badly. Health promotion is not about promoting your service So that's service promotion. Health promotion is about working with your people, your communities, your region, all the different ethnicities, and making opportunities for those people to improve their health outcomes. And that can be done through policy, it can be done through events, it can be done through the environment, which we'll talk about in a minute. So health promotion is quite important part of our role. What was I going to say then? So with health promotion, oh yeah, everybody is really a health promoter. Most of us do it quite badly. So, for instance, you might walk into a lunchroom at work and someone's sitting there eating pies and chips, and you say, that's not very healthy. That's bad for you. That's health promotion, just done badly. So what we want to do in health promotion is to change behaviours of people. So in the community, people decide for themselves that their diet is causing them health problems. So as a collective, they're going to eat their, the food pyramid. They're going to start eating their colours a day. They're going to start cutting out sugary drinks and high-fat foods. And so health promotion is then making the way easier for those people to put those behaviour changes into effect. And we'll have a look at some of the models around how to do that in a minute. So what I'd like to do now that we've discussed the purpose of it and why it's in the Stop Smoking Practitioners Program is actually go to the website. And some of you may have looked at this task, and task 4, it's probably out of the 8 tasks in the Stop Smoking Practitioners Program, the one with the most reading required. So you have to do a bit of research on the tobacco control statistics that are out there, who is smoking, what their ethnicities are, and what regions they're in. You also have to look at quite a few models of health, such as Te Whare Tapawha, for instance, the Pacific Whanawhali model. And you don't have to read all of these documents from the beginning to the end in order to do this, but you can sort of just have a look at the basics of what the models are encompassing, and then type your understanding into the assessment task. Because remember, it is level 3, so for all of this stuff, we don't need academic essays, we don't need 1,000 words for each question. We just need to see that you understand the models and how they promote health. So I'm going to go into the website now. So it takes a little bit, but you should be able to see it up on screen. So here we go into the website. Right, we're up now. I'll try and make that a little bigger. Oh, that looks okay. So you can see my mouse. So nts.org up here. You're probably familiar with this. This is our site. So we want to connect to the student learning portal. That's you guys. And I clicked on. So here. There we are. So it's quite a bit bigger now. So I'm going to put in my name and my secret password. And here we are into the main learning portal for the SSPP. So for this, I'm going to come up to the classroom, come down to task 4, tobacco control. I'll click on that. And here we can start the module 4. Welcome to Module 4, Tobacco Control and Health Promotion. This module covers tobacco control in place in New Zealand and how smoking cessation is promoted to enhance health. Here are the links to several documents for your assessment. So these are the ones you need to have a look at. So pretty much all of the questions in this assessment task, the relevant data and models of health are found here. So the New Zealand health statistics, we can have a look at the most up-to-date publications on who's smoking, how much they're smoking, and where they're smoking. Smoke Free 2025 talks about the goals around the government wanting to bring smoking rates across New Zealand down to less than 5% by 2025. Smoke-free law, there's some questions in there around the Smoke-Free Environment Act, which we'll see in a minute, and the Smoke-Free Amendment Act, which is really important to know if you're working in smoking cessation. And you can have a look at some of these. So here's the legislation down here. You can click on that and it'll show you the whole act. And the Smoke-Free Environments Regulation in 2007. And there's also, if your research takes you a bit further, you'll be able to find shortened versions about the main points that these acts of Parliament tried to achieve. So protecting all workers and the public from secondhand smoke, restricting access to tobacco to minors under the age of 18, graphic warnings on cigarette packets, hiding cigarettes out of view in retail outlets. All of that sort of stuff is covered under the smoke-free law. And here are the models of health, the Ottawa Charter. This comes from the Health Promotion Forum of New Zealand and their website at, I think it's hawara.org.nz. So that's the Ministry of Health funded health promotion agent, or not the agency, the health promotion service that delivers training around health promotion in collaboration with Manukau Institute of Technology. So this is a really great little abbreviated description of the Ottawa Charter, what it means and what it's trying to achieve. So as an example, create supportive environments. Health cannot be separated from other goals. The inextricable links between people and their environment constitutes the basis for socio-ecological approach to health. So they're talking about things like, for instance, in Hastings earlier this year, where their water source got polluted. So people worked around creating action to have something done about that unsafe drinking water in that particular city. And that's health promotion at a really high level. So the water source was polluted, people were getting sick, I think a few people actually died, and health promotion forced the local council to do something about it and get it sorted. So that's on a high level thing. So as we talked about earlier, health promotion is also about working within your organisation and creating policies, for instance. So we'll see down here, building healthy policies, this part here. So it can be about your organisation has a policy about what food can be served to visitors, what staff are allowed or not allowed to bring in for lunch. Like you may not be able to bring McDonald's in because you're a health promoting organisation. So it wouldn't sit well if you're promoting health around tobacco control and you're eating fish and chips and drinking Coca-Cola, high sugar drinks when you've got visitors, or it's about health promotion by example. So that's the Ottawa Charter. You can see it's not too long. That's it there. And you'll see the questions about how all that fits into task 4 in a minute. And so on and so on. So Te Pai Mahutonga, so Mason Jury's work, Te Whare Tapawhā, the Treaty Understanding of Hauora Aotearoa New Zealand, and the Pacific Whaniwhale model of health. So all of those resources are there for you to look at. And if we go down here, we can click onto our little learning module. And we get into the tobacco control stuff. So there's Shah introducing us. Here's some of the facts. The data. So this is getting quite old now, 2013, and of course rates are changing all the time. So when you're doing the questions about tobacco control and the statistics, you might need to get some updated. 2016, I believe, is the latest data from the Ministry of Health. And so on and so on and so on. So I can't, oh yes I can. So we all know about the risks. So this goes on, it's just quite a nice little way to continue. I'm not sure if I can get out of that without going to the end, so bear with me while I click along. Oh, I see. My co-pilot's just helping me out. Yeah. Right, so now we'll go into the actual assessment. So we're still in the classroom. There's module 4, which is the page we're on now. So onto the assessment. Download it here. Open it up. And here we go. It's quite important to read all the instructions as you do this, because the instructions will give you a list of what you need to do and what you don't. So one of the key, my internet connection is unstable. Don't copy things. You can use the references, you can look at them, but when you come down to the questions, for instance, so here's a question about the Ottawa Charter. Describe the strategy on the left according to what the Ottawa Charter says. So creating supportive environments. So we go back to that document that we just looked at in the task 4 module, and you'll see on that document that it'll have a strategy about why creating supportive environments for health is important. So if you cut and paste that section and put it in here, we'll send it back to you as more evidence required, because it's not in your own words. So you just have to type out your understanding of the strategy and the purpose of the strategy. So building healthy policy, for instance. Building healthy policy is around working with managers, community groups, to put policies in place that is going to create health gains for people. So Dr. Hayden McRobbie was talking about some health promotion he was working on in one of the big hospitals in New Zealand. I'm sorry, it was one of the big hospitals in Melbourne. So the hospital had a lot of cafes and cafeterias inside the hospital, but the hospital management wanted to go sugar-free drinks throughout the hospital. So they were going to write a policy that sugared drinks and beverages would not be served on hospital grounds or sold on hospital grounds. So, of course, all the shop owners, they were all extremely worried because they were going to lose a lot of money because most of their drink sales were high sugar, Coca-Cola, Pepsi, all of those sort of things. So the policy they came up with in working with the whole hospital community was that all the sugar-free drinks were on display for customers to see. So there was water, there was fresh fruit drinks and other sugar-free drinks in the cabinets, but they could also sell Coke, but keep it out of sight. So people could come up, they would see all the water and the sugar-free drinks right in front of them, and they were buying that stuff. So all of the shop owners were happy. But if a customer came in and said, look, I want real Coke, I don't want sugar-free Coke, they would open up a cupboard out of sight and pull them out a can of drink. So it was healthy policy that was built with collaboration from the whole hospital community, and it's working really well. So that's the Ottawa Charter. I'm going to open up one of task 4 that's been done by another student, just to show you as an example the sort of stuff we're looking for. So I'll get out of this one. I'll come into a Can you see that? Okay, so I'll make that a bit bigger. I think that's about as big as I can get it. Okay, so this is a completed assessment task by a candidate on the SSPP. We've changed all the names to protect the innocent. Buckwheat Alfalfa, his email address, good luck with Buck. This is important because we use these email addresses if we need more information or more evidence. We can just our assessors can just really easily send you a quick email, so you don't have to wait 4 or 5 days for it to go through the system, and then you get your result sheets. So it just makes it a little convenient for us, and the date the assessment was done. So the first question, review the smoking cessation literature and provide information about tobacco use in New Zealand as required below. You want to provide information on all 4 groups, as this is really critical to New Zealand. And this is the one we looked at, the Ministry of Health website. So this is the data. So the name of the reference you looked at, this person, Buckwheat, looked at the Ministry of Health website, and his data was 2009, so that's pretty old, but that's okay. So approximately 1 in 5 adults were current smokers. Smoking rates are continuing to decline. Decline in youth smoking rates, and so on and so on. So that's a good answer. Pacific people smoking in New Zealand, he got this information from the New Zealand Heart Foundation, and that is fine. It's a reputable source of information. 1 in 4 Pacific people in New Zealand smoke. Approximately 80,000 people, Pacific people, smoke nationally. About 25% of Pacific women smoke during pregnancy. This is interesting. 9 out of 10 Pacific smokers wish they'd never started smoking. Maori smoking rates in New Zealand, 2009. Again, it's quite old, but it is coming down. So this is the data that we're looking, and this is quite comprehensive. So we wouldn't need necessarily everyone to put this amount of information. This particular candidate was really into it and put a lot of information done. So long as you're answering the question, provide information about tobacco use in New Zealand as required below, So it could be something like approximately 1 in 5 adults who are current smokers, which indicates smoking rates are continuing to decline. So if the statistics are correct from a reliable source, and you've got that information in there, that's great. That'll be a pass. Question 2. Look at tobacco control legislation. Describe what the purpose of each of these pieces of legislation and what approach it takes to improve health. So the Smoke-Free Environments Act, 1990. Again, this is from the Ministry of Health website. We've just had a look at that through the link. So the overall approach of this legislation it takes to enhance health is to place more restrictions on the sale of tobacco products and to protect all workers and the public from second-hand smoke, and so on. Prohibited at schools and early childhood education and daycare centres. Restrictions on licensed premises, restaurants, casinos, and passenger service vehicles. So that's the 1990 Act. The Smoke-Free Environments Regulation Amendment Act in 2007. Oh, sorry, it's not the Amendment Act. It's the Smoke-Free Environments Regulations 2007. This was the one that required all cigarette packets to have graphic warnings and to keep tobacco out of sight. And the aim, so you'll see the question, what approach it takes to improve health. So the main aim of this regulation is to set out clear labelling for tobacco products that show that there are grave health risks for people who continue to smoke. So again, it's a perfect answer. It's quite a lot more than we really need. So it doesn't have to be that much, but you get the idea of what we're looking for here. Your understanding of what the Acts put in place and what their aim was. So this is where you're going to start to need to do a little bit of reading. So if there's a lot of people who have done diplomas in health promotion or certificate level health promotion courses through Wānanga, through the Health Promotion Forum, through MIT and other tertiary institutes. And the Ottawa Charter is the internationally recognised health promotion model that they learn all about, and they do extensive learning on it, what it means and how to take those strategies and implement them in rural settings, urban settings, in various communities across the country. So creative supporting environments. You only need, it'll say it again in the instructions, write a sentence or two to describe each strategy in the left-hand column. Then write a sentence, it should be or two, to describe the purpose of each strategy. So that's what we're looking for. We're just looking at for a few sentences to show that you've had a look at the Ottawa Charter. You get what it's trying to do and how it's trying to do that. So you actually have to read the Ottawa Charter or skim read the Ottawa Charter before you start doing this. So some people don't like reading, or they're very, very busy and there's a lot of reading to do in this assessment, and they'll go, I think I know it, I'm just going to have a bash at the answers. And they don't really understand what the strategy creating supportive environments mean. And they write a whole bunch of stuff in there because they haven't read the Ottawa Charter, the brief outline, and the assessment comes back to them and we say, you haven't actually described the purpose of the strategy to create supportive environments. So you need to go back and read and come back and do it again. So it pays to read the documents as quickly as you can so you've got an understanding before you answer the questions. So the purpose of the strategy, this student's written, changing patterns of life, work and leisure have a significant impact on health. So we can all agree with that. Work and leisure should be a source of health for whānau. The way society organises work should help create a healthy society. So you can see what he's getting at here, that if work sites are providing opportunities for behavioural change, such as healthy eating policies, no smoking anywhere in the buildings or the ground, we do not serve alcohol or allow alcohol to be consumed on our workplace, all of those sorts of things. And it's even stuff like making sure people are sitting correctly at their desks so that they're not getting repetitive strain injury from typing all day, that their chairs are the right height, their computers are the right height, so they're not getting back pain and taking days off work. All of that is around creating supportive environments. And it's not what you actually do in your work. You can use those examples, but it's described the purpose of this strategy. So what is the Ottawa Charter allowing us to do to improve health in a general setting? Strengthening community action. Community development draws on existing human and material resources in the community to enhance self-help and social support, and to develop flexible systems for strengthening public participation in direction of health matters, which is a really good answer. So if you're working in health promotion and you're setting up stop smoking health promotion events, for instance, if you're not working with your community on how this would pan out, so if you're turning up on a Tuesday morning to set up a free stop smoking promotion in front of your local branch of the warehouse, and you put up your big booth and you have all your quit coaches ready to talk to people about the benefits of quitting and how they can access services, and it's 9 o'clock on a Tuesday morning, you're going to have 5 people coming into the shop over 2 hours. If you do it on a Saturday morning, there'll probably be 500 people coming into the shop. So the community around you, the managers of the warehouse, the staff, the people themselves, they will tell you this sort of stuff. There's no point doing it on a Tuesday morning because no one has any money on a Tuesday. They're not coming to the store. Come on Saturday. That's when we're at our most busiest. So that's some of the reasons why strengthening community action is so important. The community knows what the community wants, and you've got to get that information from around you. Building healthy public policy. So we talked about one of those when Hayden was working in the hospital. Again, it's coordinated action that leads to health, income and social policies that foster greater health equity. Joint action contributes to ensure safer and healthier goods and services, healthier public services, and cleaner, more enjoyable environments. Developing personal skills. The strategy enables people to learn throughout life to prepare themselves for all of its stages and to cope with chronic illness and injuries is essential. This is facilitated in schools, home, work, and community settings. And so on and so on and so on. So here's our assessments from one of our other assessors, and she said, you have provided good descriptions of the Ottawa Charter and its purpose and strategies for health promotion. So well done, Buckwheat. Here's the little bit about the ABC model. Write a sentence or two to describe the ABC model in the left-hand column, then write a sentence or two to describe the purpose of the model. So most of you will know it's about all health workers asking clients if they are a smoker, giving them brief advice. The best thing you can do to improve your health is stopping smoking. And then provide information or assistance or refer them to an appropriate cessation program in the community or the quit line. And if this is done well, the reason stop smoking practitioners need to know this is if it's done well by GPs and nurses and physios and all of those other clinicians, then your service will be getting referrals that are really high quality. So if it's done badly by GPs, and it is often done badly by GPs, the ABCs, so a client will come in with a broken arm, the GP is required to ask about their smoking status, and the GP isn't really that keen on doing it, but he has to for the Ministry of Health. So the GP will say, okay, you're here for your broken arm, but first I see you're smoking. How many are you smoking a day? And the patient will say, oh, I'm down to about 10 now. And he says, right, that's the worst thing you can do for your health. There's the brief advice. And the GP will say, I'm going to refer you to the quit line. And the client says, okay. Or some GPs don't even ask. They go, you're smoking, I'm referring you. The next thing you know, the patient gets a phone call and it's from a stop smoking service saying, oh, I hear you're interested in quitting smoking. And they go, nah, how'd you get my number? Or, no, I just said that to get the GP off my case. So if it's done well, and again, this is a chance for health promotion, so your service might visit all your local clinics, talk to your RNs, talk to your GPs about how to do this, that your service provides really great care and support. You have to refer people to us who want to quit for their health, and we'll take care of them for you. So that's health promotion in action that enhances the ABC model. Question number 5. To answer this question, you need to have read through and considered some recognised models of health promotion that relate to smoking cessation. And remember, the reason we have to do this is because 5% of your service's budget is going to health promotion. So you need to know the models that are out there, how they work, what their aims are. So when you provide health promotion, you know you're doing it correctly. You know you're doing it well. You're working with your community. You know that the community has had input into it, that they say this will work, this will be great, it suits our needs, let's go for it. So you're working with the community. So the Pacific model of health is this candidate's choice. In the left column, he's described 4 characteristics or things about each model. And again, you only need to write a sentence or 2 about what you do while you're working in your workplace that aligns with each model. So this question is really about what you do in your workplace that aligns with the models. So the Pacific model of health, this candidate, he talks about what it is, the whanawhali, that it's quite similar to Te Whare Tapawhā, and then how he works with Pacific people to make sure that all of these areas that affect people's health are supported and mentored in his approach with working with them, and of course respected. Te Pai Mahutonga, so his Sir Mason Jury's model of health. And I'll give you an example of why this is important. When I was with ASH New Zealand, we got asked by the Ministry of Health, or we negotiated with the Ministry of Health to do a health promotion activity in Northland that was called No Smoking Day. You may have heard of Stoptober. No Smoking Day was the first sort of version of that, and it was we piloted it in Whangarei, Greater Whangarei region in Northland. And what it was about, it's No Smoking Day. We picked a day of the year that suited the area, and it was on the 1st of November, I believe. And we advertised it on local radio, we advertised it in local newspapers in and around Whangarei, that the 1st of November was a really great day to quit smoking, because in 3 marae and polytechs in Whangarei, there were going to be stop smoking practitioners on site where you could come up, have a free breakfast in the morning that was provided by the community working out of the marae kitchens, and talk to a quit coach face to face about quitting smoking. So it took us 2 years of working with Northland DHB, working with Ngāti Hini Health Trust, working with iwi to get this off the ground. And the first question they asked me when we talked to them about starting No Smoking Day in Whangarei was, why is a white Australian from Auckland coming to Northland to get Maori services to promote a model that we have no input in? And at the end of it, we got through it. It took 2 years of really hard work, and I got to know a lot of kuia, and I got to know a lot of kaumatua, and in the end, it was all evaluated under Te Pai Mahutonga. How we incorporated Māori cultural identity into No Smoking Day, where we did it. We did it in marae and polytechnics and all of that sort of stuff. Did it work? Was it useful? How we changed lifestyles, and that Māori were participating and leading this this health promotion event. And so we got through it. We made mistakes, but in the end, we did it for 6 years in a row. And I think from memory, the first No Smoking Day, we had 650 people come in and meet quit coaches on that one day. So it was quite successful, but we needed to make a few changes based on the evaluation that was done under Te Pai Mahutonga.
Okay. Thank you.
Two Hands New Zealand, a treaty understanding of Hauora Aotearoa. So again, you'll have to read this. This was quite challenging for me when I did it. I'd not really had much to do with the Two Hands document, but it's really about looking at the treaty, understanding that if we're working in mainstream or Māori organisations, we have a duty under the treaty to protect health as a taonga. And so why that is important, and how your work reflects the principles of the treaty in what we do. So you need to read all of this, the Two Hands document, and then answer the question about, losing control. So how do you describe your role and function as a stop smoking practitioner at your place with the model of health? So how does what you do in your work site align to the Two Hands document, and how you work in acknowledgement of the treaty? Finally, please enter the name of one other model. It can be a governmental model or a non-governmental model. So this candidate's chosen Te Whare Tapa Whā and described how that impacts on his service and his work in helping people to stop smoking. So, for instance, I look at their Māori and their Wairua and how they are feeling spiritual. Sometimes a simple activity like karakia can comfort whānau and help ease them through a difficult time. So again, this is quite comprehensive. We're not looking for essays, but you can see that this guy has done a really, really good job of explaining how in his day-to-day working life, Te Whare Tapawhā is supported and used when working with whānau to make sure that their quit journey is a holistic one. Question 6, review some of the reference material and information you were given in the online training resources. So that's that stuff we went through with Charlene, where we're clicking through the little screens. And describe why quitting smoking is important. And so this should be quite straightforward for all of us, because we all know the dangers, we all know the risks, and we all know the benefits, or we should all know the benefits of why stopping smoking is so good for our health. And you can see it's all the stuff that, it's quite readily available information. Your heartbeat and blood pressure go down, 24 hours, carbon monoxide is out of your system, and your lungs start to work better. Your circulation to your hands and feet improve, you feel fitter and are able to exercise easier. So it's really, really sort of basic, simple stuff, which is great. And then the very last question is, choose one example of a smoking cessation initiative and describe how it promotes health. So this candidate has described the Wirral Challenge. Some of you might know that was a competition for groups of people to quit smoking. So they would have 5 or 6 groups of 10 all stopping smoking over a set time frame. And at the end of the time frame, the group with the most people who were validated smoke-free, they won a prize, which was an amount of money donated to the charity of their choice. So it might have been a Wakahama club or a Kapahaka club or the SPCA, something like that. And so he's described that initiative and described how it promoted health by helping people stop smoking in large groups. Okay. So there it is. As I said, it's the assessment task which has probably the most reading required. It is really important to do that reading, even if you just skim read all of those documents, just so you've got an understanding and you can describe in your own words what they're for, how you use them or how you would use them, and then send it in to us at this website address. Can I highlight that? Right there. Okay. A lot of people are sending their assessments straight to me, which is okay, or straight to Edward here at Inspiring, which is also okay. But the problem with that is that when they come to me or Edward, we get so many emails that we park them to look at later and then forget. And so a month later, they're still sitting in our inbox with the assessment tasks attached, and someone will ring up and go, oh, I've been waiting over a month for my task 4 to come back. And then we have to apologise and send it off to Sue, who is the owner of this website address, and then she processes it. She processes your assessments to one of our 4 assessors, and so it's done much, much quicker. So that's just a safety tip. So now I'm going to get out of this one. I don't know how to do it. Oh, I've lost my... Here we go, excuse me. Just lost control of my... you seen? Okay. So that's it now. I hopefully that little run through of the resources available and that example of one student's work around this assessment task was in some way helpful to you. So what I'll do now is I'll unmute everyone, and if you do have any questions, you can either type them in if you don't feel comfortable in talking in a public setting, because there are 10 or 15 people listening. You can type them in using your chat function, or you can ask questions. So I'll unmute everyone now. So there we are. I can hear some people. All hear me. Does anybody have any questions around that? No, we're all good?
We're all good.
We're all good?
Yeah, we take
Yep.
makeup now. Yes.
Oh, look.
Not for that.
Did I confuse you more, or was that helpful?
Yeah, very helpful.
That's really good. I'm glad for that, because like I said, it is the one with the most reading, and some of those documents are a little heavy going, but it'll really help you answer the questions. And just remember, it doesn't have to be huge amounts of work, just so long as your answers are to the point, they're covering the questions that have been asked, it should be fine. Okay, so someone's asked a question through chat, which they're looking for access to this particular webinar that's being recorded now. So what we'll do, as soon as we're finished here, we'll give it a day or so, but we'll load this particular recording up onto one of our platforms, and then we'll email everybody and let them know the link to be able to access this if you want to have a look at it. Okay? So before we lock out, that's 55 minutes. If anybody has a question, ask now or forever hold your peace. We're all done. So thank you very much for your participation. I sincerely hope it was in some way helpful. You know where the resources are, you know what to look at, and remember Edward and I are always available via email or text or voice to give us a call just to clarify any situations that you might have. Okay, have a wonderful day, and be careful out there. And we'll talk again soon.
Thank you.
Grant.
See you, everybody. Kaki te aro.
Pagi te.
Good night, Nick.
This girl.